I was working the day shift, and around noon this patient came in. I saw the chief complaint pop up as human bites. So I clicked on it, walked into the room.
We do the full body exam, and that's when we see that she has human bite marks all over her body. So at that point, we knew something is going on.
Instant alarm was her, the way she was dressed.
She was closed off. She really didn't want us to look at the wounds, even though that's why she was there.
Patient doesn't speak English. She had another lady with her who initially came in with her, was answering all the questions for her.
She just wasn't right, her whole demeanor. She was quiet, looking off to the side, not talking to us.
Dr. Schramski went in and assessed her and came back, and he said, there's something off.
She progressed to show me a full jaw bite on her calf, above her knee, and started to undress to show me one right up by her underwear line. You know, immediately started setting off some red flags.
He initially was like, well, what if this is trafficking? So then we just like, well, yeah, she's not letting her talk, she's not doing this, like this isn't right, we need an interpreter. And
she says that she lives in Dearborn. I said, okay, well, where do you work? She says, I work at a spa.
She did mention they've been sleeping in the spa along with 4 other girls.
So I actually go to the computer, I Google it, and I'm like, oh, this is a real place. And it was like down the street from our hospital.
I said, this screams sex trafficking to me. So we took a minute out there. I called our social worker and said, hey, we're gonna go back and see this one, but I think we're gonna need your help too.
You can tell that she had been brainwashed. She told me that she had been living here for a week.
And as soon as we start asking questions, her lady partner slowly made her way out of our emergency department.
Well, at Dearborn, we're very busy. We have one of the highest acuities in the area of Detroit, but we do see a lot of sick patients in this area. I know Detroit is a hotbed for human trafficking, and it has been for a while.
Just because you don't have a case that's been identified doesn't mean that they aren't coming into your facility. It's just a matter of time.
it's scary because it's so close to home. I mean, it's in Dearborn. I live 5 minutes from here.
You know, certain things just have red flags, and I think it's very important. This situation has, you know, really opened my eyes to pay way more attention to some of the cases.
We have different points of, access points into this building. It could be somebody that's coming in for surgery. It could be somebody that's coming into the ER. So really, we need to train a lot of people across the board.
Make sure you're educated on it, pick up on the signs on it, because it could happen anywhere at any time.
Very little of what we did was medicine. The rest of it was, saving this girl from this, this situation.